Educate. Celebrate. Connect. Arizona Hispanic Connection.
Welcome to AARP, Arizona Hispanic Connection. This is David Parra, I'm your host, and today we have a very, very good topic to address, and it is access, overview, and new changes. Access, overview, and new changes. You have no idea how I've been working to put together this show, and I am very thankful to our guests today. Let me introduce them even now. I think it's proper to do it, so let me do it. My brain is good, but not great, so I have to depend on my PowerPoints, right? I want to welcome, and let me see if I get this right, it's Heidi Capriotti, and you are the Public Information Officer for Access, actually.
Access, the Arizona Healthcare Cost Containment System, or the state's Medicaid program.
Thank you for working with me. I really appreciate
My
it.
pleasure.
I know this is a very important topic, and I am glad that we're doing this show today.
Thank you for having us.
Yeah. And then I have Dana Hearn.
Yes.
And you are the Assistant Director.
Yes.
Almost the Director.
I'm the assistant director for our division.
Sorry.
Sure.
Get close to the mic. Actually, get the mic closer to you as much as possible because it is very important. The mics need to pick up your voice. Go ahead. So you're the Assistant Director. Welcome so much and thank you.
Thank you.
Yeah. Okay. So let me remind you that this is AARP, Arizona Hispanic Connection. We have this platform to educate on relevant issues, to celebrate Latino accomplishments, and also to connect the community of all ages. And today's a very important show is Access. Let me also say that this is being Facebook Live. So if you do Facebook, find our page at AARP Arizona Hispanic Connection. Find our page, like it and follow it, and then recommend it. I want to express my gratitude today that we just exceeded in this couple days 1,800 followers. We had been stationed at shy of 1,800, and now we just exceeded 1,800. So I'm very, very pleased about that. So again, please like our page. And again, we have two representatives of the Access. And I know technicalities are technicalities. Most people don't know that Access means the Arizona Healthcare Cost Containment System. So keep that in mind. So here we go. Let me read something that I have on my PowerPoint here. And it says that Access, which is Medicaid in Arizona, is a very important program and dear to AARP Arizona and me personally for various reasons. An important one being that a former director of Access from 1987 to 1993 has been of immense service to AARP. He was a state president and way more than that. And I refer to Dr. Len Kirshner. This is almost like, I don't know. I hope that he listens to this show. He is just a very special man. I don't know if you have met, I assume you know him. Who doesn't know Len Kirshner, right?
Yes.
And he understands clearly how critical Access is. He's been telling the AARP never to get it off of the agenda. Sometimes we emphasize Medicare, and he always says, no, put Access there, put Medicaid there. And he has been a fierce advocate of this program. I really thank Dr. Len Kirshner, and I know AARP Arizona, and he's well known actually nationally. We carry a great sense of gratitude towards him. So I just wanted to get that taken care of. I think it's worth it. He is a special man. He's, I believe, already in his 80s and still going strong. He's traveling a lot. And anyhow, he's a very special man. He was a former Access director. Okay, so let me ask you the first question, and I don't want to actually ask either any one of you in particular, but just between the two of you, kind of say who wants to take the questions because I think it's important. Number one, help us understand what is access. Some people say I have access. Other people say I am on access. But take us from the top, the beginning. I mean, anything that you think. Everything that you think in a basic way, what people need to know about access. Go ahead, anyone.
Okay, thank you for those questions, David. So the Medicaid program was created in 1965. The Social Security Administration Act created Medicaid for the country. It's a federal and state partnership, so every state administers their own Medicaid program. Nationally, Medicaid covers about 73 million Arizonans.
Okay.
And in Arizona, we were the last state to add a Medicaid program.
Len Kirshner always told us that.
Okay, 1982.
Yeah. Right.
Arizona joined the rest of the country and added Medicaid.
Interesting, because if it started in 92, 5 years afterwards, that's when Len served as a director.
1982.
Yeah, and then 87 is when Len started. Sorry. Yeah, go ahead.
Mm-hmm,
Yeah.
mm-hmm. Mm-hmm. Yeah. So, being the last state in the country to add a Medicaid program, we had the benefit of the hindsight of looking at what all the other states had done.
Good.
So, Arizona was the first state to create what's known as a mandatory managed care program. So, the majority of people who are eligible for access are part of a managed care program, a health care plan, just like you or I might have a health care plan.
Is that currently or from the very beginning?
From its inception.
That is amazing. The first to establish
Mandatory
managed care. That means through an insurance company?
So we contract with managed care organizations, healthcare plans, like Banner University, Magellan, and several others, to provide services to the enrolled members on Medicaid, on access.
Got it.
So the majority of our members are enrolled in what's called managed care. There is a population, including the American Indian, Alaskan Native population, that use a service called fee-for-service, so they can go to a provider, an access-registered provider, on a fee-for-service basis.
They have both options?
They have both options.
Got it.
They always have both options
Perfect.
as American Indian members, tribal members, yes. But like I said, that's about 16% of our population. The majority of our members are part of a managed care plan. So when someone applies and is eligible for Medicaid, they will choose a health care plan in their geographic area of the state. So we award contracts to managed care plans by geographic area. So depending on where you live in Arizona, you'll have options to choose from, and you'll enroll with a managed care plan.
When we talk about a partnership between the federal and state, what do we mean by that? I assume there's a match. Can you just relate to us a little bit about that match?
Yes.
So I assume the federal puts in more dollars than the state.
So Medicaid was created originally in 1965 to provide health insurance for low-income individuals, pregnant women, children, people with disabilities. The federal match is approximately 74%, and the state match makes up the rest of the cost.
So you could say that for every dollar, 75 cents roughly come from federal.
Correct.
That is an amazing...
Now, there are many programs within Medicaid.
Of course.
So that might be differentiated depending on the program.
Right.
For example, Kids Care or CHIP, Children's Health Insurance Program, is a 100% federal program at this time.
We have to almost go on our first break, but let me say this. Bringing federal dollars to the state is always a good thing. Can you say how great that is? I mean, are we talking about a big financial impact that the access programs, by bringing the federal dollars, is to our state?
I'll give you an example. Access is a $14 billion budget.
14 billion. Wow.
Yes. Right.
Is that what your boss manages?
Yes.
Wow. 14 billion?
Yes.
That's amazing.
Covering 1 in 4 Arizonans.
1 in 4.
About 25% of Arizonans.
Are we getting close to 2 million in coverage?
We're at 1.8 million.
So 1.8 million, and I believe the governor said that we just exceeded the 7 million mark in Arizona population-wise. So 1.8 are in Access.
Are enrolled in Access. We cover
Amazing.
50% of the births in the state, and that aligns with national statistics. Medicaid covers 50% of the births in the country.
Amazing. Let's take a short break and we'll come back. Stay with us. This is AARP, Arizona Hispanic Connection. The subject today, Access, Overview, and New Changes. We'll be right back. Thank you. Thank you very much for staying with us. This is AARP, Arizona Hispanic Connection. A very, very important subject today. And let me tell you, I love talking about Access and Medicare and the marketplace and everything that has to do with insurance. I believe I heard Heidi said that Access primarily offers a medical benefit, right? Medical service. It's related to healthcare, to health insurance. So that's very important to keep in mind. Let me ask another question, and then we're going to start talking about roughly defining some of the benefits that Access offers. And also, if you are listening, let me say that even though we're going to cover at the end, and that is, to my knowledge, Access will now have term limits and work requirements. Okay, we'll get to that because I see you're saying no, and I am glad I have it because that was
Just
my
some of them,
understanding.
yes.
All right, so we will clarify that aspect of the conversation, but we will not do that until about probably the third or fourth segment. So stay with us. We'll get there. We'll get there. So let me ask the next question, and that is, Len Kirshner, and again, I'm sorry to come back to Len, but he is a very precious man to us. He's almost like, I'm sorry to say, like our father, kind of, when it comes to healthcare. He's our expert, when it comes to healthcare, and we've learned so much from him. He always said that Access has, in Arizona, of course, because Access is Medicaid in Arizona, has one of the best programs in the country. Can you elaborate a little bit on that?
Sure. And Dr. Kirshner still sits on our state Medicaid Advisory Committee.
There you go.
So we still work collaboratively with him. I think, as Heidi mentioned, we have a managed care basis behind our program, and I think that collaborative effort and cooperation with our managed care organizations is really part of the foundation for the success in Arizona. We have many plans that we work with, and we work through a lot of innovative strategies to deliver health care. Earlier, you had mentioned that it's primarily physical health, and part of Access's journey over time has been to provide integrated health care, meaning that whatever plan you're with and how your health care is delivered, we're treating the entire person. So if you have physical health needs, behavioral health needs, those needs are all being addressed by one plan. So as of October 1st, 2018, we had our biggest move in integration, where 1.5 million members of the almost 9 million members moved to an integrated healthcare plan. So again, really helping to forge the efforts towards integrated healthcare and ensuring ease of the healthcare delivery to the member.
So you must be referring to the Access Complete Care?
Yes,
Okay,
Access
because I
Complete
had that
Care.
towards the end, but why
Okay,
not cover it
sure.
now, right? So this is a very, is this unique? I mean, are we unique in that, or other states are doing it as well?
I think everyone has a different pace at how they're going towards integration nationally, but I really think Arizona is really taking it in strides. And again, to have almost 98% of our population in an integrated healthcare plan speaks volumes to how we want to deliver the healthcare to
Help us
individuals.
understand in a practical fashion
Sure.
what that looks like, the
Sure.
before and the after.
Sure. So before October 1st, 2018, most individuals on Access received their health care from a physical health plan, and then if they had behavioral health, from a different health plan. So they would be navigating 2 separate health plans and 2 different provider networks.
Interesting.
And so the collaboration was still expected to be there, but it wasn't under one health plan. And so that movement over time, and our long-term care program, for example, in 1989 started as an integrated health care program plan. And we've slowly moved over time, population through population, to deliver that integrated health care instead of, or in lieu of, having members go through 2 different health plans and not having their health care delivery from the same plan for physical
Are
and
you
behavioral
telling
health
me that even long-term care?
is integrated.
That is amazing, as part of this complete care.
So long-term care from inception in 1989 was an integrated program. And over time, so in 2014, we provided integration to our individuals living with a serious mental illness here in Maricopa. The following year, that same integration was provided to individuals living with a serious mental illness in the rest of Arizona, and so on and so forth, up until our October 1st of 2018, which is, again, the biggest lift towards integration with that many members.
So an individual who had, before this date that you just mentioned, October, they had 2 networks pretty much of providers.
Yes, absolutely.
Particularly the physical versus, and then the mental health. Now they only deal with 1 network and all the providers are there.
Correct.
Wow.
So those Access Complete Care plans, or ACC plans, are responsible for managing all physical and behavioral health concerns or issues, as well as having a network that encompasses all physical and behavioral health.
Great. I'm telling you, this is great. Let me ask you, Heidi, to move a little bit closer to me, because so the camera is only capturing you part of you. Now you see this?
Yes.
Now you're complete. Just like the Access Complete. Now you're complete. Okay, let's continue with the conversation, and we're going to be moving now to a little bit more on the of the benefits that it provides, because I'm telling you, I access this page, and only you can see it. But I know you know you have it. And I mean, this is I assume your one of the main pages that you have for access eligibility requirements. By the way, this page that we're going to be using for the remainder of our conversation, you can access it on the Access website. Is it access.gov, right?
AHCCCS.gov.
Thank you. And anybody can go. I mean, I go every year, because this changes every year, right? Because of the federal poverty level limits, they always kind of change. So if you want this page, I strongly recommend it. It's an amazing page. I always refer to it. I actually, when I speak on Medicare, for example, I always have it with me. Let's talk a little bit about this page, because if you look at your page, you have coverage for children as a, on a standalone section, and then you separated it from coverage from individuals. Can you tell me why the separation? What's the difference, if you don't mind?
The main difference really relates to the federal poverty level for children by age, as you can see on that chart there.
So basically, you wanted to separate it in your chart, in your information. It goes up to age 19, from what I can see, correct?
That's correct.
And go ahead.
I was going to say, and there's specific programs within these categories. So Kids Care, or the Children's Health Insurance Program, is a program specifically for children whose families do not qualify for Medicaid. and that's why there's a difference in the federal poverty level.
So let me understand this. When we talk about children, we are actually talking about kids care then, correct?
And Medicaid. So some children qualify for Medicaid. Some children who don't qualify for Medicaid may still qualify for children's health insurance. Or
Got it.
kids
And
care.
and just very briefly, to the kids care, I think I understand that the only difference between the regular acute care from Access versus the kids care is that kids care has a small premium. Am I correct on that?
There could be a premium depending on income level.
Okay. So, but other than that, once the family or the children get the coverage, they will get just a plan, right? Access, what is it again?
Access Complete Care.
Access Complete Care. They will get a plan. It's just a matter of whether they're going to have a premium or not if they're kids care. So let's talk a little bit about, so basically, Access plans, it's all about the income, correct? I mean, for eligibility. You do not consider what resources, if I understand correctly, right? So
It depends on the program.
Okay. So I see here that there's nothing is mentioned about the resources. So let's make this clear. So when we're talking about the federal poverty level, a percentage of that is what determines what a person will get, correct? For instance, I see that children under 1, they will get 147% of federal poverty level, and then they have, if it's 1 person, if it's 2 persons, if it's 3 in the family, I should say, 4, then that determines how much money that will be to make that individual.
That determines eligibility income
Right.
level.
Okay.
So they don't get FPL. That's the basis we use to determine whether they qualify for
Definitely,
access
yeah.
or
A
not.
threshold.
Right. All right. And then when we move to ages 1 through 5, those federal poverty level move to 141%, correct?
Mm-hmm.
And then the ages 6 through 19, we're at 133%. And then, so here's where the kids care come in, right? Under age 19, but then at the 200 of federal poverty level.
Because these are children whose families don't qualify for Medicaid
Right.
based on income,
Right.
but there's still an option for this federal children's health insurance program.
Very, very clear. So as soon as somebody, if makes more than 100 or exceeds 147, basically, but no more than 200, they'll get kids care. So you cannot exceed 200%.
That is the threshold.
Right. Okay. So the takeaway here is that anybody who can fulfill the threshold, the income threshold, will get health care, and we want to almost say free, right? I mean, can we say that other than the kids care that will have a premium, and then some of the other plans will have very small, is it on medications that they pay $1, $2, something like that? So basically, we can almost say it's free healthcare, correct?
It depends on the program. There may
Okay.
be premiums with some specific programs within the Medicaid program.
Perfect. Okay, so then when we move away from what is just children, and then here you come to the individuals, the federal poverty line is still going to be considered, right? This I couldn't understand. What is the parent and caretaker relatives? What is that benefit all about?
The benefit is the same for adults across Medicaid. There's a covered benefit services.
Okay.
This talks about the eligibility. So if you're a parent or a caretaker relative, someone who's taking care of someone with a disability, you might fall into this eligibility category.
So basically, if you make less money, you could potentially get health care also. If you're a caretaker or a parent,
Correct.
but you have to make a little bit less money to make you eligible for health care, right? As I see it here, 106%.
That is the threshold.
Perfect. And then the adults, we understand the governor, help me with the governor, the name skips my mind, that expanded Medicaid.
Oh, Governor Brewer.
Governor Brewer, on the Affordable Care Act, the states had the opportunity to expand Medicaid, and she expanded. So that's why we have that for adults is 133% of federal poverty level. But then is there a 5% disregard? Because I always hear it's 138%. So there must be a 5% disregard because we always say, oh, it's 138. So I think technically it's 133, but I believe there's a 5%, so then that makes it 138. Perfect. So we're going to continue with the benefits for women because it's a little different, correct, for women. So stay with us. We're going to have to take another break. This is AARP, Arizona Hispanic Connection. We are addressing access overview and new changes. We'll be right back. Stay with us. Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. Please, if you do Facebook, go to our page and share the show and talk to friends and family about this. We are addressing important topics, very important topics on a weekly basis. Tuesdays in Spanish, Thursdays in English. And today we are joined by two representatives from the let me see, Arizona Healthcare Cost Containment System, known as AHCCCS, right? And let me acknowledge is Heidi Capriotti and also Dana Hearn, both from the AHCCCS, department, could we say? And let me briefly say, or real quick, that if we want to go farther back, would you have HHS, then CMS, and then when it lands in Arizona, it's DES, right? DES is the one that handles the access program, correct?
The Department of Health and Human Services is the federal agency that oversees the Centers for Medicaid and Medicare Services.
Got it.
Centers for Medicare
and Medicaid Services, right.
So CMS is kind of the regulatory body.
Got it.
And Access is the program that Arizona has implemented. So our waiver is approved by CMS. Our initiatives are approved by CMS. We work very closely with those federal partners.
Got it. Okay, perfect. So let's go to women. So women, do you have it in a separate section? Again, I'm kind of just wondering because it seems like you want to highlight some things in your chart that has all the access benefits, which I have to say, whoever made this, do you know who made this? This is an amazing chart. I love it.
Our member services division is
in
charge of making sure members understand what the programs are and who can be eligible for
I love it. This is a very, very good chart. So you have women in a separate category. Why? And you actually mentioned pregnant women. So are they allowed to have access, a full access plan? And I can see that it's 156% of federal poverty level. So they are allowed to make a little bit more than the regular access, and then they can get access, right?
So traditional Medicaid was established to provide health insurance for pregnant women at 100% of the federal poverty level. So when you say a little bit more, we're talking a little bit more than 100% of federal poverty level.
Got it.
So if you're a pregnant woman and you are earning up to 150, what was the chart? 6%?
156, yes.
Then you may qualify.
And this is a monthly, because you have it here. It would be for one person, 1,624. If it's a couple, it's 2,199. If there are three in the family, it's 2,773. If it's four, it's 3,000. Look, if a family of four can actually make 3,348 and still get the women I'm talking about.
Pregnant woman.
The pregnant woman. that's not a little money, you know. In other words, people can still, even when they make reasonable money, they can still get access for we're talking about pregnant women. Since we're in this topic, can you say a little something, just a little something about what is commonly known as emergency access? What is that about? What is the access, emergency access? Is that given in particular instances when somebody has specific conditions, or how is that administered?
Some individuals who are not eligible for full Medicaid coverage
Mm-hmm.
based on their immigration status may still be able to access emergency services in an emergency department, say.
Right.
And it depends on an acute situation, an acute medical emergency situation.
Got it. So does that mean they probably go to the hospital, they make sure that they can go home, and then I assume it'll depend on what condition, because if they're going to have to return to keep treating that condition, I'm sure they'll keep it for some time. But if they were to go back and then become healthy, if you will, that may change as to whether they can keep it or not. I assume it has to be it has to do something with the word emergency, right?
Acute emergency
Acute
situations.
emergency. Perfect. All right. So so we are basically learning about these benefits, but in the end, let's make it real clear. It's all about, almost all, because we're going to get to another area right now. It's all about free health care for the most part. In some instances, there will be a premium. In some instances, there will be a couple dollars that they pay for medications here and there. For the most part, and in general, we could almost say it's free health care. Let's move on to another category, because it's not only healthcare. I see here that you have. Well, here's an important topic, and I just say as much as you can, because long-term care is something that is not addressed well in our healthcare system in America still. But luckily, there is something, right? And that is ALTEX, right? The what is it called? Arizona Long-Term Care. Is it services? I think it's services. Yeah.
System.
So you have long-term care. For this one, what are we talking about when we mention long-term care? What is that?
Sure. So individuals who require a nursing home level of care may be eligible for our Arizona long-term care system, also known as ALTEX. And so they do not need to live in a nursing home to qualify, but maybe need that level of care.
That's very important. Can we repeat that? Because I think that is very important, because when we talk about long-term care, in our image, sometimes it kind of goes automatically to nursing home. But you're saying that it does not have to be. You mentioned you mentioned a key phrase, nursing home level of care, correct?
Yes, actually,
Okay.
if we go back to some of the innovations in Arizona, and what Arizona is recognized for is our home and community-based services. And we have 87% of our members that are in that ALTEX program receiving services in their own home.
80%.
87%.
That is amazing.
Yes.
And that is a great information, because here again, a person does not have to be. I assume that somebody goes to their home. Is that kind of like the home and community-based service that we're talking about when they are not in a nursing home?
Sure. So some different services that are within that program can be attendant care, case management, adult daycare, health services. It could be nursing and assisted living facility coverage if necessary. And then again, the home health services, such as nursing services or a home health aide or therapies.
Great. So for this one now, the federal poverty line moved to 300% of federal poverty level. So that means that not just anybody will qualify, because this is a very expensive care. I know that. Long-term care is super, super expensive. And we have learned that even people who have policies, they're not the greatest thing, you know. First of all, if they buy them later in life, they'll be super expensive. If they purchase them early on, they'll have a better price. But then when the nitty-gritty comes, it's not necessarily covering every single thing. Obviously, every policy is different. Now, there is a concept that I know I picked up along the way the spend down. Can you say something about the spend? Is it spend down or spending down?
Well,
Either
I think
or.
it has to do with resource limitation.
Okay.
And so the monthly income limit for someone on Altex is $2,313 as of January 1st this year.
Right.
And so for single individuals, the countable resources cannot be more than $2,000 per individual. So
Got it.
some resources are not counted, such as the home the individual lives in if it's not held in a trust, one vehicle, household and personal belongings.
So for somebody who had more resources that are allowed, then the spend down concept comes in when they would have to pay out of their own pocket until their resources meets the criteria. I think that is the concept. Am I correct on that?
So that is the resource limit in order to qualify
Got
for
it.
the
Got
Altex program.
Perfect. I really would like to ask you to say a little something about the following point because I think it's extremely critical. People are afraid of losing their homes if they get certain care. You have here a state recovery program for the cost of services received after age 55. Can you say just a little something about the state recovery program? I have received calls actually from people that are concerned, and I do believe that this is the level of care for which this could apply. The state recovery program.
I think that's a better question for an Altex specialist.
Specialist, perfect.
And you can find a list of our Altex offices. You can visit in person.
And by the way,
on our website.
can you say that where people can contact your office and other places for more nitty-gritty questions or eligibility questions, if you don't mind?
Sure.
Yes.
So for eligibility in general, one of our greatest resources is our HEA Plus or HEA Plus website. 71% of the applications today come through without state employee interaction
That is
through
amazing.
that website.
You're
So-
at that level already?
We are.
This page hasn't been around that long, right?
but
Couple-
it's doing quite well.
I
And
know.
so-
I'm surprised because I remember. I think it came after the Affordable Care Act, something along those lines, that they wanted to kind of send people to one place, and then they complete an application, and then the system will let them know what benefits they are eligible for. That's amazing. 70+% already. My wife is helping a friend, and they went to that, and so I know it. But it's a little bit of it's a lot of information that you have to provide. But once you do it,
Yes.
you will be glad you did, because then the process gets a lot easier. Go ahead. So
Absolutely.
continue.
Sure.
So there are agencies also that help or coordinate, partner with Access for helping folks to apply?
Absolutely. If you didn't want to go online, you can also call, and that's 855 HEA Plus, so HEAPLUS. You can go in person to a DES Family Assistance Center. And then we also have community assisters that are able to help individuals with the application process and knowledge about the program. And a list of those is also on the HEA Plus website, so HEAPlus.gov.
Perfect. So anybody who's not afraid of the internet, HEA Plus is the place to go, right?
Yes, and
I
you can
agree.
always call that number as well and ask for community assister
Perfect.
information.
Wow, I'm
because
still
they're
amazed.
wonderful.
78 you said? Or
71.
71% of the applications are coming through the website. That is very impressive and
And
very
that
good.
website hits federal databases to determine eligibility. So
Right.
sometimes eligibility determinations are happening very quickly.
Amazing. Let's cover real quickly, because I really want you to address the matter of the term limits. I thought they were on. You seem to say no. So that is extremely important. So you also have, Access also has the SSI. And then you have two benefits, SSI cash and SSI, is it MAO? I have no clue what that means, but these are cash benefits, correct? The SSI is a cash benefit. One is from Social Security, I think. But then again, it has to do with the federal poverty level. And this is a very important concept for everyone to understand. And roughly, the freedom to work, what does that mean? Does that mean that somebody who has been declared disabled still has an opportunity to work? Is that what it means?
Yes, for people who have disabilities who are able to work, there's an income disregard so
Right.
that you can be employed and still keep health insurance on Access.
Right.
There is a premium depending on your income for that program.
Wow, you handle a lot of programs.
We do.
Yes, we do.
It is amazing, all the programs that you handle. I really want you to address, and we're going to devote the next segment on just the And actually, what I'm going to do, I'm going to ask you to address that. And if we have time, then we go to the Medicare Savings Programs. Roughly, we'll just mention them, financial assistance for folks that are on Medicaid. But if we don't have time, what we have to definitely address is the issue of term limits and work requirements. We're going to have to go on our last break. Stay with us. This is AARP Arizona Hispanic Connection. We'll be right back. Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. The subject today, Access, Overview, and New Changes. And Access is an acronym. It stands for Arizona Healthcare Cost Containment System. We have two special guests today from the Access office, and they are helping us to kind of navigate and do a little review. But my title of this program says Overview, which I believe we already did, but it also says and New Changes. So let's get to that point. And now, because of time, let us just say that the term limits is not going to be implemented. In other words, it hasn't been approved. It's still somewhere in the process, correct?
Yes, it is not currently approved.
So the term limit would mean that a person would only be eligible to have access during a period of time. Am I correct? Just in a nutshell.
In a nutshell.
Okay, so please know, you out there in the community, that term limits is not being implemented, at least for now. We do not know what's going to happen in the future. But what it is going to be implemented starting next year is the work requirements. And I'm going to give you as much time as you need for the remainder of the program to please help us understand as best you can what is this work requirement and how is it going to work. Go ahead.
Sure. So Access received a waiver approval from CMS in order to implement the work requirement. And so I'll go over some facts about that program and what that will look like. And that's expected to begin around summer of 2020.
Mm-hmm.
And so it's for Access members, so members that are already on Access, between the ages of 19 and 49.
Mm-hmm.
And then we have a lot of different resources on our website, I do want to point out, and different frequently asked questions documents in English and Spanish in order to really help understand this program. So who is required to participate, again, would be between the ages of 19 and 49. Who do not qualify for one of our exemptions. Arizona did get an extensive list of exemptions, and so I don't know how much you want me to review of the exemptions
just briefly,
list.
if you want to mention just several.
Sure.
The
So
most common ones, if you will.
pregnant women,
Okay.
up to the 60th day post-pregnancy, former Arizona foster youth, up to the age of 26, members of federally recognized tribes, designated caretakers of a child under 18, caregivers who are responsible for the care of an individual with a disability, members who are living with a serious mental illness, and so on. We have quite a few exemptions, so I definitely encourage individuals to educate themselves and look at what those exemptions are, or call if you need any assistance in that.
Okay, so let's do in a nutshell. This would mean that if any person who is not in the exempt list would have to work how much? I mean, can you take just a little something about that?
Sure.
So say me, let's say I just have an acute care plan from Access, and I'm not eligible for any of those exemptions. What is going to be required of me?
Sure. So the requirement is community engagement. And so work is one of those modalities of completing your community engagement. But in addition to work, you could be seeking work, you could be having education, you could be volunteering and doing something in the community. And so it's going to be 80 hours per month.
80 hours per month, okay.
Is the requirement.
So that's if we just say that there's 4 weeks in a month, you're looking at 8 times 4 is to like 20 a week.
Yes.
Okay. So somebody, like if I have an Access plan, I have to be engaged in some form that you just mentioned. Work would be one of them. Now, so if I pick up a job, that potentially, if I make good money, that potentially could kick me out of the eligibility, right? I mean, that's obvious. That's reasonable to believe.
It could.
It could.
Absolutely. And I think really it would depend on what the job is and how that's going. But
How many hours?
Yeah.
What's
And the
pay?
requirement is for those that are on Access or newly joining Access.
So I have to believe, and I'm sorry to try to speak for the community, because I think I know the community quite a bit. Most of them are going to not want to work, and they're going to go to the community services, which is, according to the law, valid. So they're going to look for volunteer opportunities, you said, and be engaged in the community and be able. So I have to believe that most people are going to try to do that. I mean, I just kind of know that. And not because they don't want to work, but I'm sure there's other situations at home. Maybe they take care of the kids or what have you, and that would bring other issues that, again, obviously each person, each family was going to have to navigate that program.
Sure.
So how is Access going to know about these activities that this person who has an acute health plan from Access is going to be engaged in? How are they going to know about that?
Sure. So some of that is still in progress as we're continuing to look to operationalize the program, but they're going to self-attest to whatever their work is or their community engagement or education. And so
education would mean that they're enrolled in taking classes, taking trainings, even going to college perhaps?
yes, perhaps college.
Okay.
And could include health education, financial literacy classes, any kind of education.
Okay. So I think the spirit of the law here is that they want a person to acquire more skills and be able to move on and go to the workforce and that's what kind of like what I perceive in the spirit of the law, right?
To acquire skills and knowledge and be engaged with their communities. Because we know that people who are engaged in their communities are healthier.
Right.
And that speaks to what's called social determinants of health, in that if you're working or looking for work, involved in volunteering in your community, engaged in your community, you're more likely to have positive health outcomes.
Now, so there are the rules. Access will check on that. I assume you said that you're still working out the details. Do you think there will be a website that people might be able to use to go and report?
Yes, so there's going to be a portal that folks will go into and report on how they're doing, but we are not going to solely rely on that because some individuals may want to report in other ways.
By mail, perhaps? By phone?
Yes, and so we're really trying to make it as easy on our members for reporting.
Do you foresee that that's going to require more personnel at the Access office? I mean, is that going to have to, to be able to accommodate the reporting, the phone calls and all that? Do you foresee that might potentially require more bodies, more staff?
I think it's a little too early for us to say because we're still, working out the details and working with the portal design and how that's going to work. And so we're still early on in that.
Not so long ago, I participated. There's a coalition that has, I think it's Cover AZ.
Yes.
I'm sure you've Cover AZ. There's a coalition that has to do with primarily with the with the Affordable Care Act, Marketplace, but they help people apply for access as well.
Yes.
And they show one of the images or the documents that you are suggesting that people go and download
Yes.
at azaccess.gov, right? That's the
Yes.
page, azaccess.gov. And I also strongly recommend people to visit that page and become more educated. I do it all the time. I love the website. I think one thing that I've noticed is that the government websites, like be it Social Security, Medicare, and Medicaid, they're just being improved, and it's very, very good to see that. More user friendly. I use them a lot, trust me. But in that one meeting that I attended, there was a lot of concern of the people. How in the world are these people going to be able to report and not miss the deadlines and all that?
Sure.
It's going to be something to navigate, right?
Just like any change in our system, we really hope for a lot of partnership within our communities, our plans, our providers, to really help us spread the word. So when we just did a transition, for example, for 1.5 million members, that was a lot of community engagement to get that education out there. And we had wonderful partnership throughout all of Arizona. We did over 100 community forums and really partnered with community assisters, Cover Arizona,
Right,
et
right.
cetera. And so I foresee us continuing to partner with our provider organizations, our plans to help educate our members and make this as successful as possible.
I know that Social Security and Medicare have YouTube channels and they educate through video. Does Access have a YouTube channel that you will be using to educate?
Yes, you can find a link on the footer of our website to
Okay.
our YouTube channel. We used YouTube extensively to roll out the ACC
This
program.
is great to know. I mean, I am very much engaged. I love healthcare, and I did not know that. So that is very important to let the world know. So, and what is the name of the channel?
It's just the Access YouTube channel, and you
Okay.
can find it on the bottom of our website.
So you did not use the same name, AZ Access? You don't recall right now off the top of your head.
Of my head.
No problem. Well, I mean,
But
I'm
find it
here.
from our website.
Go ahead.
And also, there's videos typically on our website as well. And so
Perfect.
if you go to our website today, one of the very first banners you will see is about the community engagement program. So you can see that very readily right when you log on.
Perfect. Oh, I'm telling you, I'm pledging my support for all this. I will continue to address, not only because I believe in information and this is our job and responsibility and commitment from AARP to educate our communities. So you can count on me and AARP Arizona through this platform, AARP Arizona Hispanic Connection, to continue. Actually, I already contacted 2 or 3 community members of that coalition to come and join me next Tuesday to do this in Spanish. So I said the requirement is that you have to watch today's show so
Sure.
that you learn what we talk, and then we'll just do a replica in Spanish. I know you have somebody that is a Latina in your department.
I
What's
do.
her name? Do you recall off the top of your head? Because I know I wrote to her along with you. There is a lady that is a Latina, and I think she speaks Spanish. If she does, please connect her with me and see if she wants to come to join us
Sure.
for the Spanish show on Tuesday, because this coming Tuesday we'll address the same thing but in Spanish. Okay, so then the term limits is off the table, not to worry about it right now, but the work requirements, which I foresee is going to be a big change, it's on. And you said that it's going to start around
Around summer 2020.
summer
is what
of
we're
next year,
projecting.
summer of 2020. So there will be an announcement made. Okay, from this day on, we'll start. And that.
Absolutely. As soon as we have a date, we will
And once the
release
program
that.
does start, there'll be a 3-month orientation period
Mhm.
for Access members
Wow.
who are required to comply with those community engagements so they can get familiar with the program.
If you have more information on this particular aspect, reach out to me. I'll open the space to do shows anytime.
Thank you.
Wonderful.
Okay, so this is going to be all the time we have for now. Again, azaccess.gov. I'll start again. AHCCCS.gov. You'll find the link to the YouTube channel there, and visit. This is going to be a critical time for all of us to be informed and educated as to the coming changes. Heidi and Dana, thank you so very much. I hope this is only the first time that we can have you soon again.
Thank you
Thank
for
you very
having
much.
us.
All right. Thank you for joining. This was AARP Arizona Hispanic Connection. See you next time. Have a great day.